we're here in conversation, obviously, for a show on integrative pediatrics. So, Dr. Malhotra, as everyone knows you, I thought we could start with an introduction.
Sure, I think we've been now doing this show for a few weeks.
Yeah.
I'm Dr. Naveen Malhotra. I'm a pediatrician here in central New Jersey, in Piscataway and
You have two offices, right?
One in Piscataway, one in Edison.
Yes.
And I guess I've been in practice for a long time, and every time it's a recurrent theme where patients really want to know a little bit more about what they can use in addition to allopathic medicine or instead of allopathic medicine. And that's how the whole concept came about of My Whole Child, and which tries to bring in the best of both worlds.
Yeah.
And
actually, I would say the best of all worlds, because if you look at homeopathy, it's Germany. If you look at Western medicine, Chinese medicine, you're absolutely right. And I'm Anika Sharma. I'm the mother of 2 kids, and the reason why I am part of this show is because I'm a passionate believer on the fact that there's always another side to the story. The conversation cannot be complete if you do not look at alternate options, whether it's from the west to the east or from the east to the west, right?
And also the person who has been instrumental in starting this whole movement.
Well.
So we do have a website called mywholechild.org.
And we have a Facebook
page.
Yes.
So we want to invite the listeners to come in and join in and actually give us their thoughts so we can learn from you in terms of what the best is of integrative pediatrics.
And it's easy to find us on Facebook. Just go into search and type in My Whole Child, that is WHOLECHILD. Join the page, join the conversation, let us know what you think. If you have an opinion, you deserve to be on that page, so join.
Right, and I think I really do need to bring this up because as we were ending our last show, I think it was the last one or the one before that, a caller came, called us, and unfortunately they couldn't get on air, and they were quite frustrated in the sense where they wanted to talk about integrative medicine with their physician.
Yes.
But their physician said, no, if you want to practice integrative medicine, then I don't want you in the practice.
Yeah.
Which I thought was quite disheartening.
Yeah.
And
I'm wondering, does that come from because you don't believe in it, or perhaps it might even come from the lack of knowledge? So because you don't know something about it, you believe that, you cannot speak about it. So it's almost overconfidence because of not knowing the subject. Would that?
I think that's a part of it. And the other thing is that a lot of people are scared, or they've thought of integrative as voodoo, as quackery, which in some cases it is. But I think
oh please, voodoo and quackery with integrative pediatrics or integrative medicine.
But that is what people have seen, especially I guess when you look at all the Indian channels and what people are seeing and what people are advertising.
Yeah.
But
weren't you at a conference recently in Florida and you mentioned
I was
right.
So I was at the National American Academy of Pediatrics conference. And there is a whole section on integrative pediatrics.
And how well covered was it? How many people were in the room?
It was the busiest. There was standing room only.
And this was for pediatricians specifically?
Nationally.
So the top pediatricians were there.
Right.
And why was the room filled, do you think?
Because everybody wanted to learn about it. And they were so interested. Because I think it's something that's so inherent in everybody's nature to try that first as the first line of treatment.
Yeah.
So I think we're going to...
You know what we need? I was just thinking about it. I think it's and I'm really glad you brought this up because I think it shows that the doctors want to know more. It's not about, so it might be discomfort with the subject, but I think it shows that there is a growing awareness, and that's something I love about this country. The moment people are more aware, they're more accepting, right? And at the end of the day, I mean, as a parent who actually comes to your practice and as who've been troubled by me in the middle of the night and day on problems, tell me something, isn't it like the biggest thing is about finding a solution, right? You don't really care whether it comes from the west, east, north or south, right? It's about finding a solution to a problem, right?
Of course. And I think we do want to open this up to the audience in terms of what your thoughts are. And you can call us during the show at 732-297-9886. That's 732-297-9886. About what your thoughts are and what you may have tried and what may have worked, and definitely not a diagnosis on the air, but or exact treatment, but I think more thoughts and viewpoint.
So we're talking about something very interesting today. Speaking of remedies and solutions, we're talking about one of the most common problems in kids, right? And even adults, ear infections.
Right, and I think this is something that everybody is so scared of.
Yes.
And they say it is the bread and butter of pediatricians because
Yes.
it is the most common diagnosis that we come up with
Yes.
or we see a child for.
Yeah.
And which is so funny. And on my way here, the call that I got from one of the parents was about a baby that was tugging their ears.
Oh.
And the baby's crying. So
How
really,
is the baby?
well, we won't go into the details on that.
No,
but
what I mean is, I don't know what your definition of baby is.
Well, this one was a few months old.
Oh, okay.
So, the parent is very worried about, is
Yeah.
this an ear infection?
Yeah.
And that's one of the most common fears that
Yeah.
parents have, is they want to come in to get their child checked just because they want to make sure the
Yeah.
child does not have an ear infection. Especially if they're traveling, especially if there is a holiday coming
Yeah.
up. They'll go and sit in the emergency room for hours and hours
Yeah.
to find out.
And
if the
catch
child-
other infections.
and catch other infections.
Yeah.
But what we do want to impress is that ear infections are not an emergency, that they do not have to go to the emergency room.
Yeah. Doesn't it hurt the kids though? I think the parents are scared that the kids are in pain.
I think that is what triggers the
Yeah.
visit to the emergency room.
Yeah.
So, the child starts crying in the middle of the night
Yeah.
and the parent just does not know what to do.
Yeah.
And at that point, their biggest concern is that, oh my God, it's an ear infection, it's an ear infection.
Yeah.
So,
Correct.
right? So it's like...
I remember when I came, you will not remember because you meet a million kids, but I remember when I came in, I think it was with my son, and he was rubbing his ears or something, and I came in and he told me it's an ear infection. You didn't ask me a single thing. You know the only question you asked me? So how many days is he in childcare? And I'm like, what? I'm like, he's not in childcare, he's with a mother and it's all organic food and organic this, and you said, it doesn't matter. It's not that childcare is bad or daycare is good, good or whatever. It's just about exposure to kids, being in an area. And I'll tell you how I felt. You have to know how I felt. I felt like a mother who had failed her job. It was almost like, it probably means that I haven't, cleaned my kids' ears. So please tell me that was a wrong feeling.
That is the wrong feeling.
Thank
and
you.
I'm glad you brought it up so many years afterwards. But
Like literally, it was like 8 years ago or 9 years ago. I still feel, you made me feel like, my God, I failed my duties.
So what happens is usually a predisposing factor might be that the child has had colds.
Yeah.
And the cold has been lingering on.
Yeah.
The risk factors are that they've been in daycare. So
Yeah.
they're picking up a lot of different germs, different
Right.
colds. And if the cold doesn't go away on its own, then that cold can settle into the ear and cause an ear infection.
So it's not a hygiene thing.
It's not a hygiene thing.
It's
no.
a fluid retention thing or something,
Yes.
right?
So it's not that you didn't clean out the ears properly.
Oh,
or
thank
you-
God.
Or you didn't give the child a bath properly.
Yeah,
But
yeah.
it is something that comes from inside.
Yeah. Are some
So-
kids predisposed to it?
There are some kids that are predisposed to it. So what
Yeah.
happens is there is the eustachian tube.
Mm-hmm.
That's the tube that connects the ear to the throat.
Yeah.
And that tube in kids is more is in a different alignment or different shape.
Uh-huh.
And as they get older, that shape changes or that contour changes.
Okay.
So then that's why the adults don't get as many ear infections
Yeah.
as kids do.
Yeah.
So whenever you get a cold, you get blocked off.
Yeah.
That eustachian tube gets blocked off, and it tends to, that fluid stays there, and that fluid can get infected.
So I remember in India, I'd never heard the word ear infection, but I remember while growing up, if I ever felt that my ears were hurting, my dad would tell me to put some hot oil or, like do something. Does it even work? I mean, what is that? Is that just a myth?
No, it is not a myth. So it is something that will help. We don't recommend it, unless you know what you're doing.
So he was actually practicing integrative medicine.
So he was practicing integrative. So the hot garlic oil
Uh-huh.
is known to be a good pain reliever.
What relieves? Oh, so it's the garlic or the oil?
I think it's more the heat.
Uh-huh.
So that tends to help and temporize the measure until you get
Can
seen.
you imagine a parent putting hot garlic oil in their ear?
That's the issue. It's like
Yeah.
if it's too hot, it can burn.
Exactly. You'll
So-
probably come in with another problem then.
And probably get reported to the authorities for child
Oh,
abuse.
thank you.
So-
What have you done to your child? So anyway, join the conversation. 732-297-9886. Tell us the most bizarre things that you have done to take care of ear infections, and really how crazy has it driven you as a parent? Because I remember I almost felt like, Dr. Mirotra had given me an F mark or something on my report card as a parent. It was horrible.
No. When we first see a child, we want to
Yeah.
make sure that we're getting a full history, so it makes the diagnosis a little bit easier.
Yeah.
So history.
With me, you cut straight to the chase. You're like, how many days? I'm like, what?
So a lot of parents will say that their child is in daycare only maybe half a day or
Right.
maybe only 2 hours or something,
Yeah.
but that's enough.
Yeah.
Enough of a time.
So, but working parents like me need that support system. So the answer is not, because I remember what I did. I immediately took my son off all kind of daycare options and lugged him to every meeting and everything, which is also not the solution.
Right.
So what is the solution?
Letting them grow up and dealing with the symptoms and dealing with the diagnosis as it comes.
Okay.
So there are only very few things that are known to prevent ear infections,
Okay.
of which one of them is smoking. So if you're a smoker in the house, definitely you need to get them out of the house. Sorry, fathers or mothers who are smoking, you need to stop
Oh,
smoking
that
right away.
actually causes ear infections, the smoke?
It predisposes the child to, yes. So
Because
that is
it irritates,
that
okay.
is known as a prevention of ear infections.
I see. The
Breast-
same will work in a car or something. So it's basically exposure to smoke.
Exposure to smoke.
Okay.
So secondly, breastfeeding. So
What?
you need to breastfeed.
Oh. Oh my God! For a second I thought you were going to say breastfeeding causes ear infection.
No. So breastfeeding actually will prevent.
Okay.
Is
Why
the-
is that? Because it pops the ears?
No.
I was getting crazy.
So it's well documented that breastfeeding decreases your risk for ear infections.
Okay.
So the immunity that you get.
Okay, so that's an immunity overall thing, right?
Right.
Okay.
So
But this has been proven.
these are well documented in the
Okay.
research studies.
Okay.
Beyond-
Mothers, feed your kids.
Feed your kids,
Breastfeed
yes.
your kids.
Yes, if you have a newborn, that is
Yeah.
what you do need to do.
Yeah, or a 1-year-old.
Or it depends, yes.
Yeah.
So it depends on how long you want to breastfeed.
Yeah.
And then the other thing is, a lot of kids may be predisposed to allergies. And I know we've talked
Yeah.
about allergies in the past.
Yeah.
So allergies can set you up for repeated ear infections.
Yeah.
So ear infections, if they do happen, they do need to get treated.
Yeah. Now
So-
they're recurring too, right? So it's possible
They-
that you might actually see someone with an ear infection and then they might just come back. So
Sure.
Okay.
That's where, some ear infections are viral in nature.
yeah.
So those tend to go away on their own. If they are not viral in nature or they look more bacterial, then antibiotics may be needed.
Really?
So that is when.
See, that's the next word I fear as a mother, antibiotics. Like, yeah, it is.
So parents may, end up using Ayurvedic remedies or homeopathic remedies, and if it's viral, it'll go away.
So what happens if I don't take antibiotics and I just ignore the problem? It's not going to go away, right?
If it's viral, it
It'll-
will.
Oh, if it's viral, it will. Okay.
Right. And
Okay.
if it doesn't, so sometimes, we may tell the parent to wait
Okay.
and just come back if the symptoms get worse.
So an ear infection can be caused by bacteria or virus.
Right.
I see. How as a doctor do you know?
You may not know. So based on the symptoms
Okay.
of the child, you can go ahead and decide to treat or not to treat.
Yeah.
So in the meantime, you go ahead and give them symptomatic relief by
Yeah.
giving them that hot garlic oil, if that's what you
Yeah.
end up using.
It should be warm to your
warm.
touch. Okay.
Some people have homeopathic medicine back from
Yeah.
India that they may use
Yeah.
to temporize, and
Okay.
you can go ahead and use just like a heating pad by the ear,
Yeah.
and those are things that will help.
Right.
So at least some sort of pain relief for the child
Right.
until the child gets
Wasn't it like a fashion trend or something 5 years ago where I remember every second child I knew had tubes in the ears? I mean, really.
That's what parents fear, right? So
Yeah, so what is that? What do those tubes do and how do you decide? I mean, it almost become like an accessory, I remember. Like every, happening child had tubes in the ears.
yeah, well, if they're getting repeated ear infections, that is
Yeah.
what the measure is that's taken. It's a surgical procedure where the tube
Oh my
gets in
God.
to drain the fluid.
Okay.
Okay, so
and
that,
it helps.
And it helps.
And then they melt after some time or something? Is that what it is?
No.
No, I don't know. We get pictures every day from Mars. Today we don't make meltable tubes.
No, they tend to fall out on their own. So
Oh,
as
they
a
do?
child, yes.
Okay.
So they might stay there for a year and a half.
Okay.
And
So
then
my
they
thought
tend-
was half crazy. So that's okay. So I'm reading this and it says something about chiropractic care, or it talks about like all kinds of oils, talks about probiotics. So it almost feels like you need to improve the immune system of your body. And is this something that's across
So,
all kids?
Well, that's sort of the common question that I get from parents.
Yeah.
Isn't there something that I can give to my child to raise the immunity?
Yeah.
And then they'll bring all of the different concoctions back from India. They've had these
Not back from
tonics.
India. It was no pomegranate juice, or I don't know, cod liver oil.
Or no,
or
there are a
something.
lot of tonics that they can get from the Indians ethnic stores.
Yeah.
You know, ye gutti, wo gutti, and
Huh.
that will sort of boost the immune system.
Huh.
But really, there's nothing that's been proven
To boost the immune
to boost the
system?
immune system.
Let's agree to disagree on
So
that.
let's take a caller here. So I know we're running out of time, but let's take. Hello, you're on the air.
Hi, how are you? Trying to call you, but you guys didn't say the number often and slowly. So finally, I got a chance. Quick question: you're a general pediatrician, or there's some kind of specialty?
General pediatrics.
Oh, well, I have a general question. Do kids get migraines?
Kids can get migraines, yes.
Okay.
And we'll probably cover migraines in a future week. But what is the quick question that you have?
From my daughter, she's 14 actually right now, and for 2 years she's been having this problem. She gets a headache on a daily basis. I have basically done everything I could medically, for example, and all sinus tests and all different things. So there's no
How old is the daughter?
there's no tumor or anything
Well,
like that. So
Right. So that is.
some told me there's a migraine. Some said no. So
Yeah, unfortunately, you know, the things that we fear are tumors that the child may have, and you've ruled that out, so that's a good thing. Kids can have migraines, and those migraines can be quite debilitating. So let me just get you off air here, and then just listen in, please. So migraines can happen in kids, and there are some medications that are used for migraine prevention. The neurologist can probably, if you have seen a neurologist, you can talk to the neurologist about that and maybe put your child on that on a daily basis and hope that the migraine, that the child will outgrow that as time goes on. There are some integrative things that are done for migraines and headaches, meditation, stress relief, music therapy, and there are some Ayurvedic and homeopathic treatments that may be out there. Definitely not my expertise,
Yeah.
but you know, those are things that you can look into as well. So
But,
thanks.
but you know,
think
I could.
we have another
Another
caller.
caller?
Yeah. Hello, you're on the air.
same person.
Sorry.
We're regarding migraine headache.
Yeah, go ahead.
So I mean, I completely, I really empathize with her because she sounds like a worried parent, and you can feel that in her voice,
Right.
and I'm sure it's the same kind of frustration.
Yeah, are you still on the air?
Yes.
Yeah, so you can probably, I guess, email us
Yeah.
so we can talk a little bit more about this and maybe we can see what can be done.
And our
The
email
email
ID
address
is
drmehrotra1@gmail.com, so that's drmehrotra1@gmail.com, or just you can message us through Facebook or our website, mywholechild.org, because I know we're getting towards the end of the time. So anybody who wanted to call in for questions or concerns, the studio number is 732-297-9886. But
I to
definitely
her
you can.
point, it is 732-297-9886.
986. Thank you for slowing me down. So, but definitely you can go ahead and try to get us through our Facebook page.
Yeah.
We are probably going to take a break in the next month and not be on air because of the holiday season and the change in timing, and probably will come back in January with other topics.
Yeah, so to close, because I know we have couple of minutes left.
About a minute left.
Yeah, so to close, Dr. Malhotra, can you shed some light on what's the difference between an earache and an ear infection?
Sure. Earache is a symptom that
Yes.
a child has, which could signify that the child has an ear infection,
Uh-huh.
but not necessarily that the child has an ear infection just
Mhm.
because they have an earache.
Okay.
So
So when
earache,
should I panic as a parent?
you should never panic as a parent. because you. So as a parent, you need to make sure that you are strong and you support, and if you panic, your thought
I think
process.
we have a new tagline for my whole child. Never panic as a parent. There is always a solution, right?
Or if there is not, we help you navigate the solution.
I like
So-
that.
So the thing is, you have to be calm and sane, because
When
if
have you ever met a calm and sane parent? I'm just curious.
so I know we're in the last 10 seconds.
So join us.
So join us, and definitely you can email us, or you can go ahead and
Yes.
Facebook
Yes,
us,
yes.
so that we can continue the
Yes,
conversation on
yes,
integrative pediatrics,
yes.
and make sure that you are able to talk to your physician about the options.